Now, before we talk about side effects, fall risks, or medication interactions, there's something very important that many people never fully understand, and that is this. Not all blood pressure medications work the same way. I often meet people who tell me, "Doctor, my neighbor takes Amlodipine, so why am I taking Losartan?" Or they say, "My friend was switched from Lisinopril to another medication. Does that mean one is better than the other?" These are reasonable questions, but the answer is not as simple as one medicine being good and another being bad. Think of your circulatory system as a network of roads carrying traffic throughout a busy city. When blood pressure becomes too high, it's like there's too much pressure on those roads every single day. Over time, that pressure can damage the heart, the kidneys, the brain, and the blood vessels. The goal of treatment is to reduce that pressure, but different medications accomplish that goal in different ways. Amlodipine works by helping blood vessels relax and widen. When those vessels become less tight, blood can flow more easily, and the pressure inside the arteries begins to decrease. For many older adults, this medication can be very effective because it directly helps open up the pathways through which blood travels. Losartan takes a different approach. It blocks the action of a hormone in the body that causes blood vessels to narrow. By preventing that hormone from doing its job, the blood vessels remain more relaxed, making it easier for blood to circulate. In addition to helping control blood pressure, Losartan may offer benefits for certain people with kidney concerns, which is one reason healthcare providers sometimes choose it. Then there's Lisinopril. This medication works earlier in the same hormone system. Instead of blocking the hormone itself, it helps reduce the body's production of a substance that tightens blood vessels. The result is similar. Blood vessels stay more open and blood pressure comes down, but the pathway it uses is different. Now, here's the key takeaway. Even though all three medications lower blood pressure, they do not affect every person in exactly the same way. Your age, kidney function, medical history, other medications, and even your genetics can influence which medication works best for you. That's why comparing your prescription to someone else's often leads to confusion. The medication that is perfect for one person may not be the ideal choice for another. This is also why patience is important when starting treatment. Sometimes a doctor may adjust the dose, sometimes a second medication is added, and occasionally a medication is changed altogether. That does not necessarily mean something is wrong. It simply means your treatment is being tailored to fit your body's needs. One of the biggest mistakes people make is assuming that once their blood pressure numbers improve, the medication is no longer necessary. In reality, the medication may be the very reason those numbers have improved in the first place. Understanding how these medications work gives you something incredibly valuable: confidence. Instead of feeling uncertain about the pill you take each day, you begin to understand why it was prescribed and what role it plays in protecting your health. And when you understand your medication, you're far more likely to use it safely, consistently, and successfully. Knowledge is not just power, it's protection. Now that we understand that amlodipine, losartan, and lisinopril work in different ways, the next thing many seniors need to know is that these medications can also affect the body differently. And while millions of people take these medicines safely every day, recognizing potential side effects early can make a tremendous difference. One of the most common concerns I hear is, how do I know if what I'm feeling is a side effect or just part of getting older? That can be a challenging question because some medication side effects can mimic problems that people often associate with aging. Let's start with amlodipine. Many people do very well on this medication, but one of its most common side effects is swelling in the ankles, feet, or lower legs. Sometimes this swelling develops gradually. A person may notice that their shoes feel tighter than usual, or that sock marks remain on their skin longer than before. Because the swelling is usually painless, many people ignore it for weeks or even months. What's important to understand is that this doesn't necessarily mean the medication is dangerous or harming the body. It simply means the blood vessels have responded in a way that allows fluid to collect in the lower extremities. However, it is still something that should be discussed with a healthcare provider because adjustments can sometimes improve the situation. Now let's talk about Losartan. Many patients tolerate Losartan quite well, but some may experience dizziness, especially when first starting the medication or after a dosage increase. Others may not feel any symptoms at all, but still experience changes in kidney function or potassium levels that can only be detected through routine blood testing. This is one reason regular checkups remain so important. Feeling fine doesn't always tell the whole story. Sometimes the body gives obvious warning signs, and other times the clues are hidden beneath the surface. Lisinopril has its own unique side effect profile. The one that surprises many people is a persistent dry cough. It often isn't severe, but it can become annoying. Some individuals describe it as a tickle in the throat that simply won't go away. Because it may develop weeks or even months after starting the medication, many people never connect the cough to their prescription. I've seen patients spend considerable time searching for causes, seasonal allergies, dust, colds, even changes in weather, without realizing the medication may be contributing to the problem. There is also a rare but serious reaction associated with lisinopril and similar medications. This involves swelling of the lips, tongue, face, or throat. While uncommon, it requires immediate medical attention because it can interfere with breathing. The key message here is not to become fearful of these medications. Fear often leads people to stop treatment without medical guidance, which can create far greater risks than the side effects themselves. Instead, I encourage people to become observant. Pay attention to changes in your body. Notice if your shoes suddenly fit differently. Notice if you develop a cough that wasn't there before. Notice if dizziness appears after starting a new prescription or changing a dose. These observations provide valuable information that can help your healthcare team make better decisions. Remember, every medication involves balancing benefits and risks. The reason doctors prescribe these medications is because uncontrolled high blood pressure can silently damage the heart, brain, kidneys, and blood vessels for years before symptoms appear. The goal isn't perfection. The goal is awareness. When you understand what side effects to watch for, you're not becoming anxious. You're becoming informed. And informed patients are often the ones who experience the best long-term outcomes because they recognize problems early and address them before they become bigger concerns. Your body speaks quietly before it shouts. Learn to listen. As we continue, I want to focus on something that often receives far less attention than it deserves. Many people worry about whether their blood pressure is too high, but they don't always think about what can happen when blood pressure drops too quickly or when the body needs time to adjust to treatment. This brings us to an important issue for many seniors: dizziness, lightheadedness, and the increased risk of falls. Now, to be clear, medications like Amlodipine, Losartan, and Lisinopril are designed to lower blood pressure. That's exactly what they're supposed to do. The challenge is that sometimes the body needs a little time to adapt to these changes, especially when a medication is first started, when the dosage is increased, or when multiple blood pressure medications are taken together. Have you ever stood up from bed in the morning and felt a brief wave of dizziness? Maybe the room seemed to shift for a moment. Perhaps you felt unsteady and instinctively reached for a nearby chair or wall. Many people dismiss those experiences because the sensation passes quickly. But those few seconds can be incredibly important. As we age, our bodies don't always adjust to position changes as efficiently as they once did. When you move from lying down to sitting or from sitting to standing, gravity causes blood to move toward the lower part of the body. Normally, the cardiovascular system responds rapidly to keep blood flowing adequately to the brain. However, blood pressure medications can sometimes make that adjustment process a little slower. The result may be temporary dizziness, blurred vision, weakness, or a feeling of instability. And here's why this matters so much. For younger adults, a brief dizzy spell may be little more than an inconvenience. For older adults, it can lead to a fall. A fall is not simply a fall. A fall can mean a fractured hip. It can mean hospitalization. It can mean months of rehabilitation. In some cases, it can lead to a loss of independence that changes daily life permanently. That's why I often tell patients that preventing falls is just as important as controlling blood pressure. The good news is that many fall-related injuries can be prevented with simple habits. One of the most effective strategies is also one of the easiest. Slow down when changing positions. Instead of jumping out of bed, sit on the edge of the mattress for a few moments first. Give your body time to adjust. Move your feet, take a breath, then stand up gradually. The same principle applies when getting up from a chair. Pause briefly before taking your first steps. Those extra few seconds may significantly reduce the chance of losing your balance. Hydration also plays a role. Many seniors unintentionally become mildly dehydrated, especially during hot weather or when illness affects appetite and fluid intake. Dehydration can worsen dizziness and make blood pressure fluctuations more noticeable. It's also important to pay attention to patterns. If you consistently feel lightheaded after taking your medication, or if dizziness becomes more frequent, don't assume it's something you simply have to tolerate. Discuss it with your healthcare provider. Sometimes a medication adjustment, dosage change, or timing modification can make a meaningful difference. Another mistake people make is trying to push through symptoms. They tell themselves, "I'm fine," even when their body is signaling otherwise. But symptoms are information. They help identify potential problems before those problems lead to injuries. Remember, the goal of treatment is not just to lower numbers on a blood pressure monitor. The goal is to improve overall health while maintaining safety, mobility, and quality of life. Managing blood pressure successfully means protecting both your heart and your independence. A few careful seconds today can prevent a life-changing fall tomorrow. Now, after talking about dizziness and fall prevention, we come to another topic that many people underestimate because it often happens quietly, without obvious symptoms. And that topic is monitoring your kidney health and keeping up with routine blood tests. One of the biggest misconceptions I hear is this: if I feel fine, everything must be fine. I understand why people think that way. In everyday life, we often rely on symptoms to tell us when something is wrong. If your knee hurts, you know your knee needs attention. If you have a fever, you know your body is fighting something. But the kidneys don't always work that way. In fact, kidney problems can develop gradually and silently. Many people feel perfectly normal even when important changes are occurring behind the scenes. This is especially important for people taking medications such as Losartan and Lisinopril. Now, let me be clear. These medications are commonly prescribed, and they help countless people control their blood pressure successfully. In many cases, they can even help protect kidney function over the long term, particularly in individuals with certain medical conditions. But because these medications influence systems that affect both blood pressure and kidney function, healthcare providers often monitor patients with periodic blood work. Some people become concerned when they hear that blood tests are needed. They assume it means the medication is harmful. That's not the case. Think of it this way. If you own a car, you don't wait for the engine to fail before checking the oil. Routine maintenance helps identify small issues before they become major problems. Monitoring kidney health works much the same way. When blood tests are performed, healthcare providers often look at markers that help evaluate how well the kidneys are filtering waste from the body. They may also check potassium levels because certain blood pressure medications can influence how the body handles this important mineral. And here's where things become especially important for seniors. As we age, kidney function naturally changes. The kidneys may not process medications as efficiently as they once did. This doesn't mean something is wrong. It's simply part of the aging process. However, it does mean that regular monitoring becomes even more valuable. The challenge is that many people skip follow-up appointments because they feel well. They think, my blood pressure is under control, so I probably don't need another checkup. But some of the most important information about your health can't be felt. You can't always feel a potassium imbalance. You can't always feel early changes in kidney function. You can't always feel how your body is responding internally to a medication. That's why routine monitoring serves as a safety net. It allows healthcare providers to confirm that the medication is doing what it's supposed to do while ensuring that your body continues to tolerate it well. I've seen situations where a simple blood test identified a small change early enough for a quick adjustment to solve the problem. Without that test, the issue might have continued unnoticed for months. This is also why it's important to tell your healthcare provider about any new symptoms, even if they seem unrelated. Fatigue, unusual weakness, changes in urination, swelling, or unexplained discomfort may provide clues that deserve further evaluation. And remember, follow-up care is not a sign that something is wrong. It's actually a sign that your health is being managed responsibly. Too often, people think of medical appointments as something they only need when they're sick. In reality, some of the most valuable appointments are the ones that help keep you healthy before problems develop. Managing blood pressure successfully is about more than taking a pill each day. It's about building a complete system of care that includes monitoring, communication, and regular check-ins. The healthiest surprises are the problems you catch before they become problems. As we move forward, there's another issue that surprises many people because it often doesn't involve the prescription itself. Instead, it involves everything that surrounds it. You see, when most people think about medication safety, they focus on the pill in the bottle. But sometimes the bigger story involves the other things that enter the body alongside that medication, the over-the-counter remedies, the supplements, the vitamins, the herbal products, and even certain foods. This is where many seniors unknowingly run into trouble. I can't tell you how many times I've heard someone say, "It's just a supplement," or "It's natural, so it must be safe." The reality is that natural does not automatically mean harmless, especially when medications are involved. Your body is like a carefully balanced system. When medications such as Amlodipine, Losartan, or Lisinopril are prescribed, they are designed to work within that system in specific ways. Adding other products, even products that seem innocent, can sometimes change how that system functions. Let's start with something many people never think about: salt substitutes. When individuals are diagnosed with high blood pressure, they are often encouraged to reduce sodium intake. That's good advice. In response, some people replace regular table salt with salt substitutes. The problem is that many of these substitutes contain potassium instead of sodium. Now, potassium is an important mineral. Your body needs it. But for people taking medications such as Losartan or Lisinopril, excessive potassium intake may sometimes lead to levels becoming higher than desired. The challenge is that many people don't realize they're increasing their potassium intake because the product is marketed as a healthier alternative. The same concern can apply to potassium supplements. Some individuals begin taking them without discussing it with their healthcare provider, assuming that more potassium must be better. But when medications and supplements overlap, unexpected effects can occur. Then there are over-the-counter pain relievers. Many people keep these medications in a cabinet and use them regularly for arthritis, back pain, joint discomfort, or headaches. Because they're available without a prescription, it's easy to assume they're completely risk-free. However, certain pain relievers can affect blood pressure control and may also place additional stress on the kidneys, particularly in older adults or in people already taking blood pressure medications. This doesn't mean nobody should ever use them. It simply means they should be used thoughtfully and with appropriate medical guidance. Herbal supplements create another area of confusion. The supplement industry offers products that claim to improve circulation, increase energy, boost immunity, support heart health, and much more. Some products may have real effects on the body. The issue is that those effects are not always predictable when combined with prescription medications. Unfortunately, many patients never mention supplements during medical appointments because they don't think they're relevant. Yet sometimes those supplements provide important clues when blood pressure readings change unexpectedly or new symptoms develop. Even certain vitamins and nutritional products can influence treatment plans depending on the individual's health conditions and medication regimen. That's why one of the simplest and most effective habits you can develop is keeping an updated list of everything you take. Not just prescriptions, but supplements, vitamins, herbal products, and over-the-counter medications as well. Bring that list to appointments. Share it with your pharmacist. Review it whenever a new medication is prescribed. This small step can prevent a surprising number of problems. The goal is not to make life complicated. The goal is to ensure that every part of your healthcare team has the complete picture. When they know everything you're taking, they can identify potential interactions before those interactions create challenges. Remember, medications don't exist in isolation. Every pill, supplement, and remedy becomes part of a larger conversation happening inside your body. The safest medication plan is the one your healthcare team knows about completely. As we come to our final point today, I want to talk about one of the most important lessons anyone taking blood pressure medication can learn. In fact, if you remember only one thing from this entire discussion, I hope it's this. Never stop your blood pressure medication without speaking to your healthcare provider first. Now, I understand why people sometimes consider it. Perhaps your blood pressure numbers have improved and you begin to wonder whether you still need the medication. Maybe you've experienced a side effect and decide it's easier to stop taking the pill. Sometimes people read something online, hear advice from a friend, or simply grow tired of taking medications every day. After all, when you feel well, it's natural to ask yourself, do I still need this? But here's the challenge. High blood pressure is often called the silent condition because it usually doesn't announce itself with obvious symptoms. Many people feel perfectly normal even when their blood pressure is dangerously elevated. That's one of the reasons it's so deceptive. You may not feel your blood pressure rising. You may not notice damage occurring within your blood vessels. You may not realize that extra strain is being placed on your heart, your kidneys, and your brain. And because those changes happen quietly, people sometimes assume they're healthy simply because they feel healthy. The truth is that medications such as Amlodipine, Losartan, and Lisinopril are often controlling a problem you can't feel. Think back to something we discussed earlier. When blood pressure numbers improve, many people assume the medication is no longer needed, but in many cases, the medication is precisely why those numbers improved in the first place. Stopping treatment suddenly can remove that protection. For some individuals, blood pressure may begin rising again within days or weeks. Others may experience a more gradual increase. Either way, the risk is that uncontrolled hypertension returns without warning. And over time, uncontrolled blood pressure increases the likelihood of serious complications such as heart attack, stroke, heart failure, kidney disease, and vision problems. Now, this doesn't mean you should stay on the same medication forever regardless of circumstances. Treatment plans can change, dosages can change, sometimes medications are reduced, sometimes they're replaced, sometimes lifestyle improvements allow for adjustments. But those decisions should be made thoughtfully using blood pressure readings, medical history, laboratory results, and professional guidance, not guesswork. One of the most common mistakes I see is people making medication decisions based on a single reading. Maybe they check their blood pressure one morning and it's lower than usual. Immediately, they wonder whether they should skip their medication that day. But blood pressure naturally fluctuates. It changes throughout the day. It responds to stress, activity, sleep, hydration, illness, and countless other factors. That's why one isolated number rarely tells the entire story. Another important point is communication. If a medication is causing side effects, don't suffer in silence. If you're struggling with costs, discuss it. If you're having difficulty remembering doses, mention it. If you're concerned about long-term use, ask questions. Healthcare providers can't solve problems they don't know exist. Many medication issues have solutions, but those solutions begin with a conversation. Throughout today's discussion, we've talked about understanding how these medications work, recognizing side effects, preventing falls, monitoring kidney health, and avoiding potentially harmful interactions. All of those lessons point toward the same goal: taking an active role in your health rather than leaving important decisions to chance. The safest patients are not necessarily the ones who know everything. They're the ones who stay informed, stay observant, and stay connected with their healthcare team. Your medication is more than a daily pill. It is a partnership in protecting your future. And when it comes to protecting your heart, never let feeling better become the reason you stop doing what's helping you stay well.